Welcome to the Qserve podcast on the MDR Deadline Countdown. My name is Gert Bos, I am CSO at Qserve and I will be your host today. The first podcast series contains 5 episodes where we will guide you towards the implementation of the MDR. Because many of you have requested, we will launch additional special episodes. So are you planning to implement the MDR? Or are you just really curious about the process? Then follow our podcast channel called Qserve Talks and get ready for all the insights from an interdisciplinary group of experts. In our last episode, together with Eric Voldebrecht, we discussed a selection of legal issues in regard to the MDR. Today, we will address the topic of the availability of notified bodies. Joining me is Sabina Hoekstra. Sabina is co-chairing the Commission Work Group NBCG Med, as well as the Notified Body Association Team NB. She is appointed as Regulatory Strategy Principal in the Medical Health Service Division of Qserve Product Service GmbH. Welcome, Sabina. So every episode, I would like to kick off with one general question. This time, I'd like to ask you, Sabina, what is your favorite medical device and why?
Okay, thank you, Gert, and thanks for having me in this podcast series. And in this interesting times, we can have an interesting exchange of thoughts. Well, back to your question: what is my favorite medical device and why? I do not have a favorite medical device, but I do have a favorite category. I have a pharma background, and I moved into medical devices some time ago. And I developed a kind of professional hobby, and that means I'm intrigued by the systems available worldwide that are used for regulating medical products. And I have a special interest in where these two systems for pharma and medical devices interact. So I have a special interest in combination products and also in products on the borderlines of those two regulatory systems.
So that's very interesting. You search for the most complex in the world, and I guess that's where you landed. I suggest we move to the first subject of today, and that is the availability now as well as in the near future of notified bodies. It's a very critical question for those manufacturers whose notified body is still in the pipeline for full designation. How should I be aware of the situation they are in their case? The Commission publishes overviews of how many notified bodies are in what stage. Today, there are 20 in Nando, and it's slowly rising, but the rest is guesswork. Even though they say 1 or 2 is coming, you don't know which ones. And asking various notified bodies where they are results in many opting for the one place being nearly there. This makes the future extremely uncertain. And what, in your view, is the current situation? And what is our potential way out of these unclarities?
Yeah, this is, of course, a very interesting question. And you are absolutely right that the European Commission publishes each quarter an overview on the notified bodies, how many are in which stage of the designation process. But of course, legally, they cannot publish the names of the notified bodies. That's not possible. You only know when, like earlier today, one is published in Nando, the IT system of the European Commission, where all the notified bodies for each legislation are published, and then you know. So that is, but they cannot. And if we look at the situation now, there are, if you look at it a holistic perspective, there are 2 issues: the total notified body capacity and the speed of designation. And those 2 publications of the European Commission give an indication for the speed of designation, but that is also not very clear from the graphs that they present. At the moment, they have received in total 51 applications for the MDR and 15 for the IVDR. And as you mentioned, 20 notified bodies have gone through the process, and that is for the MDR and 4 for the MDR. And that is, if you look to the speed of designation, that is not, the European Commission is not delivering its promise, because they, in the earlier years, they promised time on time that there would be 20 MDR notified bodies by the end of 2019. So that is more than 1 year and 3 months delay. And to get a little bit more insight in what does this graph mean, the Notified Body Coordination Group did a survey in September among its members, And we have asked all the notified bodies if they could exactly indicate the duration of all the steps in the designation process. And the outcome was, well, if you look at from a speed of designation perspective, was quite disappointing, because the duration of the whole process was approximately 700 days. That's more than 2 years. And the most time consuming was to get the notified body's CAPA plan accepted for sending it to the joint audit team. This took on average more than 200 days. But those are historic data. That was last year. So we have started a kind of top-up survey in March last month, but we have only received approximately 50% of the responses that we should get. So we only have some very preliminary results. But what we see is that there is an improvement and that the designations process seems a little bit quicker than what we found last year. So that is good news. So what is the potential way out? Well, of course, as I already mentioned, is faster designation, but also a more efficient use of the existing resources for the notified bodies that are already designated would also help the notified bodies to create more room so that they could help the manufacturers. But up till now, how can we clarify this unclear situation? Yeah, to get a little bit quicker through with it. And then the other way is, notified body own their own data. So, ask the individual notified body. That's the only way that you can do, because if you ask the authorities, they are not allowed to answer those questions. Did that answer a little bit of your question, Gert?
Yeah, so Sabina, it does, but it remains confusing because, well, apparently if we ask different notified bodies, they seem to be all saying that they're in the same spot, where the Commission only says there's one or two in that particular spot. So that is hopeful from their end, but not necessarily very clear. I'm thinking, and maybe that's a bridge too far, but is there a way of notified bodies sharing between themselves a little bit of the lessons learned or the trend, or how to interpret the requirements on notified bodies based on these joint audits? Or I know in the past the Commission shared kind of commonly issued deficiencies, and they explained why there were deficiencies. Is that type of process of harmonization still ongoing?
Not in that sense, of course, notified bodies, but all those surveys that I talk about are purely voluntary. And what we do is and it is also anonymous, because it is up to the notified body what they want to disclose, also in the service that we are running. And we have always an open text field where people can share lessons learned, remarks, comments, and that is used quite frequently, I can tell you. And what we do when we sit together in our meetings twice a year, we share those comments and we discuss with each other. So that is a way of that we try to harmonize a little bit, and that is the only way at the moment. It is not that the Commission shares on a meta level. Well, how shall I say it? Lessons learned or something. That has changed. I'm now on board somewhat more than a year, and I have not seen it that happens. But maybe in the past, and maybe it's a good habit that we could reinstall again.
So who knows? But the good thing is that at least notified bodies are sharing some of the lessons learned between themselves. So hopefully that will help speed up those bodies still working on their CAPA plans, or even in earlier phases of the application. So let's move to the next topic, which basically is with the 20 we already have designated, looking at their availability of actually performing the work that is at hand. What percentage of work would you estimate the joint notified bodies under the MDR will be able to handle during the upcoming final sections of the grace period that is now starting? So what percentage of expected MDR certificates is issued, or what is the estimation for this year, next year, and beyond? And how can manufacturers help their notified body to ensure they will be on the list of receiving the certificates in a timely manner?
Yeah, this is again a very interesting question, but you might, and we have some data, and I will talk on that. but it is very hard to estimate exact percentages that could be done. But you also in your introduction, when you introduced me to the listeners, you said I was also involved in Team MB, that is the Association of Notified Bodies. Currently, we have 26 members, but Team MB covers the majority of the capacity in Europe, and also Team MB does surveys among their members, and the latest one is from December 2020. And there we have asked the members a set of different questions, and the answers can answer your question. One of the questions was, how many certificates do you currently have up in the air? Let's formulate it like this. At the moment, under the directives, how many have you issued for the upcoming regulations? So it is not split in MDR and IVDR. And how many applications did you receive? And so this is the state of play by the end of last year. And basically, if we look at it, then the number of certificates that have already been issued is around 1% of the total number of certificates for the directives. And that is disappointingly low, but there is a very logical explanation, because since the COVID, notified bodies cannot do audits on site, and that really hampers the process of the issuing of the certificates. But the other question is more interesting, and that is, how many applications have you already received? And that is about 10% of the total number of directives that is out there. So only 1% has been issued, and 10% we have received applications. So that is lower than we would expect. So that tells us a little bit about how many manufacturers are already ready to file with the notified bodies. So that is one part of the question. So of the answer. The other thing that we also have asked the notified bodies is how many certificates that are currently in that big group that you have under your that you have issued is expiring. And here we see a kind of wave of workload coming to the notified bodies, because the number that is expiring later this year is a little of 10%. Then we go to 2021, then a little bit above 10%. Then we go to 20%. And then the rest is all expiring in 2024. And that is really a little bit like half. So a little bit more even. So, of course, I know that you cannot compare apples with pears, that you cannot compare directive certificates directly with regulation certificates, but it gives already an indication that the rest of the work, that a lot of work of the transition from NDD to MDR is pushed till the latest year in the transition period, and that is 2024. So, but if notified bodies are able to have the directive certificates, a certain number, and then you would spread the workload and you would pool the workload, not all the workload in 2024, because that will really be a problem, but have it a little bit earlier and spread it also over the earlier years, and then you of course have to correct that transferring from MDD to MDR is more work. Then in total, if you look at the area under the curve, basically in total, it looks a little bit better than if you only look at the certificates that are expiring in the last year of the transition period.
So it might look a little bit better, but still a grim picture that you're painting with the big hurdle of everything having to be done in the last year and a half. And manufacturers apparently not being ready to apply for their certification conformity assessment. I hope you didn't hear the noise of me falling off my chair, because the percentage that you mentioned of like 10% of the manufacturers actually having had the application under their belt, that is astonishingly low. So I guess we should encourage manufacturers to finalize and at least get started on part of their portfolio to use that early lessons learned, as well as the available resources that notified body currently might have. at least relating to now more time available than in the near future once we get closer to the deadlines.
Yeah, and if I may say so, there is one confounding factor that is not helping, and that is that currently there is a formal requirement that notified body, in order to issue a certificate, must go on site. And there has been a lot of discussion also in media about, and the Commission has issued a notice on that. But that notice basically is not more than just an encouragement to the member states not to punish the notified bodies if they do not do an on-site audit. And then there are a lot of restrictions and constraints, case by case basis, needs to be immediately followed when it is possible, etc., etc. And we are now at a stage that it is more or less up to the member states how they implement this Commission notice. So the fact that there are some projects that cannot be finished because the notified bodies cannot go on site does not really help this situation. So even the applications that we have got, some of them the notified bodies can't finish for this reason. So that does not help to make the overall picture brighter, if I may say so.
No, I would agree to that, and obviously, if member states have different perspective on that, which is what we see, that doesn't help harmonization either. Let's move to the next topic, which basically is a topic that will be close to your heart, as you indicated at the start of our discussion. That you love combination products and the meeting of both worlds. But actually the meeting of both worlds is kind of cumbersome, and not alone. Also the clinical scrutiny is still to some extent in the legislation. So a number of these processes are in such a way that a notified body in isolation cannot make up their mind. They have to either have a clinical review done by an expert panel, or they need consultations for combination products, where in many cases various consultations done in the manufacturer's portfolio, sometimes over the 2 decades that the products have been on the market by different notified bodies or by different drug agencies, they are not a complete match to the current portfolio in many cases. So grouping of dossiers is a debate under one consultation. Might be more strict than it has historically been. And the process is just about to start, I guess. What in your mind is the best way to move forward on these?
Well, for a manufacturer, it is talk with your notified body. Again, as Notified Body Coordination Group, we have been in contact with the HMA, that's the heads of medicines agencies, and that is more or less the joint agencies in different member states on pharmaceuticals. Because for the combination products, the drug device combination products, where the pharmaceutical substance is of ancillary action, there is this guidance out there. That's the guidance it has a long title, but we call it the 2012, and it basically says that if there has been a consultation under the MDD, that it is obligatory to do a reconsultation with a drug agency if the product is transferred to MDR. So basically, there is a huge workload for the pharmaceutical authorities. And what we have tried to do as MBCG is to liaise with them and to come up with a kind of a joint action plan how we can tackle this workload, because I talked about wave of workloads for the notified bodies, but there is also a wave of workload for the pharmaceutical authorities. But we are still in the beginning of this conversation, because also for notified bodies, it is a little bit of a mirror of what you sketched before, not always clear where they can go with what kind of combination products, which competent authority for pharma takes them and which not. So that is quite unclear. So there are first steps to clarify this situation, and then when it is clearer for the notified bodies, it is also clearer for the manufacturers. But we are at the early days of that process. So in the meantime, it is approach your notified body, and the notified bodies approach, they have relations with competent authorities, they approach the competent authorities, and that's how it works at the moment. And I agree, would like to say that this is not the optimal way how it could go, but this is the state of play. But I'm hopeful for the future because, there needs to be a kind of streamlining of this workload for the pharma agencies. And then back to your previous question on the expert panels, there is good news. They have been opened last week, so they are available. And a notified body that needs to go via an expert panel now can do. There was a lot of last minute work on the whole IT structure, but I understand from my colleagues in the clinical area that it works. So we have some progress there. That is good news.
That indeed is super news, and also on the combination products, I guess also as some of that is logistics and how will the system work, that will have the attention also of drug agencies and the commission to work and focus on it. Maybe we can focus a little bit on that as well as move back to the harmonization between notified bodies that we touched upon earlier. If you look at what historically the MDCG, the Commission Joint Authorities have been doing, it is not hard to see that they have mainly been working on building guidance to get the system running. So the designation of notified bodies, UDEMED, vigilant reporting, and so on. So the mechanics behind the legislation. A couple of the guidances already have been on content, regulatory and clinical content. But there's much more need for the industry, and that's also a lot of the hesitation probably why they haven't applied. So many questions about, well, is it good enough? Is my biocompatibility from a few years ago, is that still okay? Toxicity, is chemicals. What about sufficient clinical data, as you mentioned, the clinical scrutiny? Can my product be seen as well-established technology? Will the notified body accept it? Will this clinical expert team accept it? And it moves on, and the questions on PMS, PMCF, SSCP, what to write, when and where, and many more questions. What do you anticipate the authorities will pick up in the near future? And what do you expect the joint notified bodies in either MBCG Med or in Team MB can contribute further to that harmonization of the expectation being published in one way or another?
Yeah, well, there are two ways basically to mainstreams how this can be achieved. One is there is around the MDCG, the Medical Device Coordination Group, there is a whole system of working groups, and most of those working groups, and I will go a little bit into the clinical one later on, consist of two meetings basically. There is the meeting with authorities only, that is the Commission and the member states, and there is this, it's not completely open because you have to fulfill all kinds of requirements to be admitted, but they also have meetings with stakeholders, and usually notified bodies are quite active in those stakeholder meetings, and that is also for us a mechanism to give our wishes to the authorities where we see that there is really a need for additional guidance. And some of those are, not wishes. Wishes is too, not that it is that we wish it for our own sake, but we see that it is needed to get the system running. So, but some of those wishes seem to have been accepted or are on the way of accepted. And for instance, in the clinical one, there has been a lot of discussion about updating the current, the 2007 MANRA4, the guidance on clinical evaluation. Up till now, the authorities have said no. That is a lot of work, etc., etc. So we notified bodies have come up with the idea not to revise it totally, but to have a kind of dynamic Q&A document on clinical topics. And then, of course, this well-established use is among them. That we have a series of quicker, shorter documents that go into several topics. And well, that was not received unfavorably. Let's put it that way. So that is, and we are also members in a lot of groups. And what we also have seen over the past year is that there are a lot of surveys, especially devoted to the notified bodies, that the authorities ask the joint notified bodies a lot of questions. I can tell you it is a lot. So that is also a way that we can give our input. And then I said there were 2 ways, but then the third way is that the notified bodies are working internally amongst each other. And this is more for the notified body only technical topics. And you say, well, the MDCG and the authorities do as they used to do within the notified bodies. Well, there was this MDMET. With the new MDR, there is a dedicated article in the MDR, Article 49, and one in the IVDR, Article 45, that really gives a legal basis to the coordination of notified bodies. And we have, used is not the word, but since there is now a legal basis, we have reissued our structure, how we work together, that we really have technical groups working on technical. That's called the Notified Body Technical Group, not a surprise name. And we also have a more overarching plenary notified body coordination group. So we try to work in a kind of revised format to be more efficient. The technical groups prepare the work, and then the overall group accepts it or not. And within those meetings, we have also dedicated sessions. Again, a little bit like the same mechanism as the NDCG with stakeholders. We have dedicated sessions with the Commission and the member states. So we have been trying to adopt the way we work a little bit to the environment that we are working on. There is a very technical topics that at the moment we are working on, and the structure still needs to grow. But I am quite optimistic to the future that this enhanced structure will result in, maybe the word harmonization is maybe a little bit too far, because we are, again, early days, but in a more understanding and leveling between notified bodies internally.
So it's good to hear that there's so much energy, Sabina, ongoing on the alignment, I would say, between notified bodies, as well as some even positive news from the rollout plan that might actually get into the clinical. Very happy to see that would be kind of a top up, because the amount of time spent on getting the last revision 4 of this guidance was immense, and we cannot have that again. So hopefully, indeed, some tweaks would come to us sooner rather than later. Unfortunately, we have come to an end of our episode. I hope you had some fun in recording the session, Sabina.
I did, yes, thank you.
And I hope that you listeners at home have gained some great insights. For now, I would like to wish you all a lovely week and hope to talk to you in our next episode, which will be held together with one of my colleagues from Qserve, Bianca Lutters. In that podcast, we will be discussing biocompatibility and toxicity. So keep an eye out on our website and social media, and talk to you soon.